Antibiotics, right now, are something you've probably never thought about once. You get an infection, you take a pill, and you expect the problem to go away. But a little over a century ago, antibiotics didn't exist. And infections still had to be survived somehow. So what did people actually do? Imagine you cut your hand. Not a dramatic injury. Just a cut. Today, you'd probably rinse it, cover it, and forget about it. But imagine that same cut in the 1800s. A day or two later, the skin around it is red and hot. Then it starts swelling. Maybe there's a throbbing pain underneath. Then comes the really bad sign, pus. The infection isn't staying neatly inside the cut anymore. It's spreading into the surrounding tissue. And this is where history gets uncomfortable. Before antibiotics, doctors couldn't simply reach for a drug that would circulate through your body and attack bacteria. An infection could turn a small injury into something life-threatening. And it wasn't just cuts. Childbirth could lead to deadly infections. Surgery could end with an infected wound. Pneumonia could turn breathing into a struggle. A tooth infection could spread beyond the mouth. And once an infection became severe, doctors had remarkably few reliable ways to stop it. But people weren't completely helpless. They had been experimenting with infection for thousands of years. Some methods were crude. Some were surprisingly sensible. And one of them eventually changed medicine forever. So, before antibiotics, what was actually keeping people alive? The first method was also the most obvious. Survive long enough for your own body to win. For many minor infections, that's essentially what happened. People rested. They ate when they could. Wounds were protected. And doctors tried to keep damaged tissue from getting worse. If an abscess formed, they could open it and drain the pus. It sounds primitive, but there's an important idea here. Sometimes the problem wasn't finding a magical medicine. It was removing what was causing the problem and giving the body a chance to recover. And humans had been using substances on wounds for a very long time. One particularly interesting example is honey. Ancient Egyptian medical texts describe honey being used on wounds. And there's a reason this isn't completely ridiculous. Honey can actually inhibit the growth of some microorganisms. Of course, ancient Egyptian physicians didn't know about bacteria. They weren't thinking, I'm going to disrupt microbial growth. They were thinking much more simply, this seems to help. And that was often how medicine progressed. Try something. Watch what happens. Repeat it if it works. But sometimes, letting the body fight wasn't enough. So doctors had to get more aggressive. If an infection was trapped in one place, one solution was brutally simple. Remove the infected tissue. Surgeons could drain abscesses, remove dead tissue, and in extreme cases amputate an infected limb. Imagine having an infected leg in an era before antibiotics. The surgeon couldn't give you penicillin and wait. If the infection was spreading upward, there was a terrifying calculation. Could they remove the infected part before the infection killed you? Amputation was obviously dangerous in itself. But sometimes removing the source of infection was the only chance. And here's the strange part. The biggest problem wasn't always the operation. It was what happened after the operation. A surgeon might successfully remove the damaged tissue, only for the wound to become infected afterward. This is where 19th century medicine began to change dramatically. Because doctors were slowly realizing something that sounds obvious to us now. Maybe the best way to treat an infection was to stop putting germs into the wound in the first place. By the 1800s, some doctors began taking cleanliness much more seriously. And this was not just about making a hospital look tidy. It was about survival. Ignaz Semmelweis noticed something horrifying in maternity wards in the 1840s. Women giving birth in one hospital ward were dying from childbed fever at much higher rates than women in another. The difference? Doctors and medical students were moving between autopsies and childbirth examinations. Semmelweis introduced handwashing with chlorinated solutions. Deaths dropped dramatically. That idea eventually connected with the growing understanding of germ theory. Then came Joseph Lister. In the 1860s, Lister began applying antiseptic methods to surgery, including the use of carbolic acid. The smell was harsh. The chemical was irritating. But the goal was revolutionary. Keep microorganisms away from the wound. Clean the instruments. Clean the surgical area. Treat the wound. And suddenly, operations that had once been followed by deadly infections became much safer. This was one of the great hidden victories of medicine. Doctors didn't yet have a reliable way to kill bacteria inside your body. But they were getting much better at stopping bacteria from getting there. And then medicine made another leap. What if you could attack the actual organism? Once scientists accepted that specific microorganisms could cause disease, the question changed. Instead of asking, what makes the patient feel better? They could ask, what kills the thing making the patient sick? That sounds obvious now. It wasn't. One early breakthrough was Salvarsan, developed by Paul Ehrlich and introduced around 1910. It was designed to target the organism responsible for syphilis. Then came the sulfonamides in the 1930s. These were among the first widely useful antibacterial drugs. For the first time, medicine was moving toward something that sounds incredibly familiar today. Take a chemical, put it into the body, let it attack the infectious organism while trying to spare the patient. And then, in 1928, something almost accidental happened. Alexander Fleming noticed that a mold contaminating one of his bacterial cultures had created a clear area where bacteria weren't growing. The mold was producing something that stopped the bacteria. He called it penicillin. But here's an important detail that often gets lost in the famous story. Fleming didn't simply discover penicillin one afternoon and suddenly everyone had antibiotics. It took years of additional work to purify it, test it, develop it as a treatment, and eventually manufacture it on a huge scale. That work accelerated in the late 1930s and early 1940s. And then everything changed. The real turning point wasn't simply Fleming discovered mold. It was the transition from preventing infection and supporting the body to systematically attacking bacteria inside the body. Sulfonamides arrived in the 1930s. Penicillin became a practical treatment in the early 1940s. And during World War II, mass production turned penicillin from a laboratory breakthrough into a medicine that could be used on a huge scale. That changed the calculation completely. A wound that once might have progressed from redness, to swelling, to pus, to a life-threatening infection could now sometimes be treated with a drug specifically designed to attack the bacteria. And here's the part that actually surprised me. Antibiotics weren't responsible for every major improvement in infectious disease. A lot of progress had already happened. Clean water, better sanitation, hand washing, improved nursing, antiseptic surgery, vaccination. All of these were reducing infectious disease before antibiotics became widely available. So the story isn't really, people suffered until penicillin saved everyone. It's more like a series of increasingly clever defenses. First, keep the body alive. Then clean the wound. Then prevent microbes from getting in. Then identify the enemy. And finally, attack it directly. And that brings us back to the thing sitting quietly in your medicine cabinet. A little packet of antibiotics doesn't look particularly revolutionary. It's just a pill. But historically, that pill represents an enormous shift in how humans understood disease. For thousands of years, people could watch an infection spread without knowing exactly what was happening. They could clean wounds, drain them, cut away infected tissue, use substances that seemed to help, and hope the body's defenses were enough. Then, over generations, medicine slowly figured out what was actually happening. The enemy wasn't some mysterious force inside the wound. It was a living organism. And once you could identify the enemy, you could start designing weapons for it. So the next time you're handed an antibiotic for a bacterial infection, remember, you're not just taking medicine. You're using the result of a centuries-long detective story. And if you had to choose, which would you trust most before antibiotics existed? A doctor trying to clean and drain the infection, a surgeon willing to cut it out, or an old-fashioned remedy like honey?